pick things up in South Sudan, where aid organizations are sounding the alarm of a worsening cholera outbreak. Most of the cases are being recorded at camps for refugees and the internally displaced, where sanitation is often inadequate. The situation is being aggravated by the arrival every week of hundreds of people fleeing conflict-hit Sudan. Unity State has reported 92 deaths, with over 1,200 cases treated in the state capital, Bentiu, in 1 month alone. Another 25 deaths have been recorded in camps near the national capital, Juba. A bacterial disease usually spread through contaminated water. Cholera causes severe diarrhea and dehydration. Left untreated, it can be fatal within hours, even in previously healthy people. For more on this, we spoke earlier to Dr. Margaret Harris, the World Health Organization spokesperson, on the interventions being made to resolve the cholera menace in Africa, particularly in South Sudan.
In fact, it's a major emergency globally. We classified the global resurgence of cholera that we have been seeing since 2021 as a grade 3 emergency in January 2023, which is our highest internal level for emergencies. And this is due to widespread outbreaks, but also, and this is a real problem, this is why, to answer your question, this is why it's come back, resource limitations. Countries are dealing with conflict, but they've got poor water and sanitation systems. They've got many people who are displaced, but they simply lack the means to prevent it and also to treat it. Vaccines help. They're a tool, but they are not the main thing. The main thing is getting clean water available to all people and separating that clean water from where people use it when they use it as a toilet. So you've got to keep the sanitation, the toilet facilities, and the water separate. And this is what's not happening. So unless you can ensure that people have access to genuinely clean water, and it's not mixed at all with water that's where people are going to the bathroom, and when they are in camps and they're displaced and they're in very difficult circumstances, that's a hard thing to do, but it's absolutely critical. Now, the vaccines can help people not to have this as severe an illness, but that's only one little tool. The main thing is really getting your water and sanitation systems, helping people understand how they get cholera, how to stop it, and really knowing where it is and taking action quickly to break the transmission, the infection from person to person.